Well, today, coverage for the Canadian Dental Plan begins for those 65 and older who, of course, are eligible. This program is expected to provide dental coverage to uninsured families who earn a household combined income of less than $90,000. Now, it's being rolled out in phases, and the eligibility age brackets will be lowered in the coming months. Now, this program, which the government forecasts will cost $13 billion over 5 years, a key part of the Liberal government's political pact, the supply and confidence deal with the New Democrats. Now, about 1.7 million Canadians have signed up for the plan, but at this point, just over 5,000 dentists have, many saying they have concerns about the program. So let's get into this morning with Federal Health Minister Mark Holland with what we should also mention today is National Physicians Day. So I know you'll be speaking to physicians today and thanking them for the work they do. But let's start with these numbers. The 1.7 million signing up, but only 5,000 dentists signing up here. Is this going according to plan, or are dentists and dentist offices kind of slow to come around to this?
Well, we're up to 6,500 now. So, that number has been growing steadily. And I can say that we've had really good conversations with the dental associations. Every time they have concerns, we fix them. And, they represent an extraordinary profession who does, a remarkable job taking care of people's oral health. Mm-hmm. But we have 9 million Canadians who don't have access to coverage right now. And so it's so important we close that gap. I know they share that, but it's time to get on. It's time to serve the people who need it. We have these seniors now, 1.8 million have signed up who are ready for care. We've got 6,500, more than 6,500 dentists. We've got a new portal opening July 8th. It'll make it even easier for dentists to participate. Really, we've made it a simple, easy process, and we need to get coverage to everybody.
What is it you're hearing from dentists that seems to be the hesitation as to why they're not sort of signing up into this program?
Well, that's getting harder to answer, if I'm honest. There was a concern at first that there was a contract, that it was too complicated, so we went from 27 pages to 2 pages, just so that it's a standard claims and processing agreement. And there's still some said, well, we don't want to participate in case you change things in the future. So we give them a chance to just interact on a one-off basis. So now you'll be able to bring your card in just like any other insurance plan, punch it into the existing computer system you have, and people get paid within 2 days for about 90% of the procedures. For anything that's really complex, you need what's called pre-authorization to make sure that it's needed, because that's more expensive. But this plan has no limit. If it's medically needed, we're going to do it, and it's important that we get coverage. So I'm not really sure. The remaining issues seem to be more apprehension that we're not going to treat them fairly. We're very invested to working with them, and they're in being successful.
And from a patient perspective, if you like your dentist, can you keep your dentist, or can you only go to ones that have signed up?
Well, so today, until the new portal comes in, because July 8th, July 8th, basically any dental office will, whether or not they are participating or not, can punch that information in and get paid, as I say, inside of 2 days. But for now, between now and July 8th, it's participating dentists. But I would say to dentists, sign up, see what you think, drop out if you want, and on July 8th, you can go on a claim-by-claim basis. So on that basis, we're seeing hundreds of new dentists come on, every week. So we're going to see more and more. And we always knew this was going to be iterative. This is the largest federal program ever in Canadian history. You remember, well, maybe we can't go back that far, Nick, but I mean, we can think back to when we were starting up Medicare in this country, and the difficulty of getting doctors on board and getting that system up and running. It's a big challenge, but it's important. We have to make sure that everybody gets oral health care, and certainly that's true for seniors. We have now 1.8 million. It's time to give them service.
Okay, you talked to me just before we came up under that you'll be speaking to some dentists in London, Ontario this morning, and sort of people who work in mouths, I suppose, about this. I'm sure you've also been hearing, though, from a lot of doctors recently about the recent federal budget and the changes to the capital gains tax situation for doctors who incorporated, in a sense, kind of to avoid increasing fees too much here. Are you at all concerned about this backlash you're hearing from the Canadian Medical Association or the Canadian doctors about either threats to either leave or concerns that they may sort of not be able to retire the way they had planned? What are you hearing, and what are your concerns?
Yeah, well, first of all, look, I am so appreciative of the doctors in this country and the extraordinary work they do, and also of nurses and personal support workers and dentists and hygienists and all the people who are involved, denturists, in providing health care in this country. But, we have to make sure that our system is fair. And what we know over the last 5 years is that folks who have capital have made a lot of extra money. And if you talk to personal support workers or physiotherapists, they're really struggling, a lot of them. And so what we're doing as a government is making really important investments through the health system to make sure that we've got a fair deal for everybody. And that means, in this instance, if you're making more than $250,000 in profit, which is what capital gain is. Right now, you get to keep your first 50%. You don't pay tax on it. And then we're saying beyond $250,000 a year, then you're going to pay tax on 2/3. So you still get 1/3 that's tax-free. And given how much capital has gone up and how much more people in the top 1% have made over the last 5 years, that's keeping our system fair. And I think that's really what is at the heart of this, is making sure whether or not you're a nurse or a personal support worker or a physiotherapist, whoever you are, that we're treating everybody fairly and making sure that we're there with something that makes sense for everybody. And that means the people who have the most are going to be asked to pay just a little bit more.
I hear your fairness argument there. I just wonder if you're concerned at all. We know here in Ontario, for example, 2.5 million people don't have a family doctor right now. That number expected to potentially double over the next couple of years here. As a health minister, how concerned are you about the doctor shortage and that this may exacerbate some of that?
Well, look, salaries are provincial, and I think there are fair questions to be asked in terms of how much salary is paid. I mean, capital gain is a different thing. That means that you've made money, that's all profit. So, and remember, when you're incorporated, we're not changing those rules. You still get to benefit from incorporating. There's a lot of tax advantages to doing that. But I would say on the broader question, where is the government investing $200 billion over the next 10 years in our health system? I've gone personally to every province, every territory, and we've signed health agreements to work on making sure we do have enough doctors and nurses and personal support workers, and that we're making the changes to our health system to make sure that our public health care system, which is one of the best in the world, becomes the best in the world, which includes, by the way, dental care, which we're launching today.
Right. Okay. Big day indeed for Health Minister Mark Holland. Thanks for joining us on Breakfast to talk more about it. Thanks for the time.
So much, Nick.
Appreciate this.
It.